Welcome to Medicare Help Group, a quick guide for your Medicare queries. Let Medicare Help Group assist your needs. Today we will be talking about dental coverage. The American Dental Association said that individuals 60 years and above face some rather unique dental concerns. Approximately 1 in 4 senior citizens have gone 5 years or more since their last dental visit, and 16% in this age range consider their oral health as poor. Also, there are more than 500 medications that cause dry mouth, an example of which are those prescribed for high blood pressure, high cholesterol, and many more. This is now the common cause of cavities in older adults. Unfortunately, Medicare doesn't always help with this issue since, according to Medicare.gov, this federal health insurance program typically does not cover dental care, procedures, or supplies. So, what does Medicare cover when it comes to dental health? Medicare will contribute toward oral examination needed before any surgical procedures, such as kidney transplant or heart valve replacements in certain situations. Now let's begin with original Medicare's Part A dental coverage. Under Original Medicare Part A, members may be covered for certain dental services received while in the hospital. This include any emergency or complicated dental procedures deemed necessary at the time. An example of an emergency or complicated procedure that is often or at least partially covered is a jaw reconstruction needed as a result of accidental injury. Another is if an extraction is needed to prepare a patient for radiation treatment as a result of jaw-related neoplastic disease. Health Plan says that this category of condition includes diseases involving the growth of tumors, both cancerous and non-cancerous in nature. Medicare will also contribute toward oral examinations needed before kidney transplants or heart valve replacement. Specifically, this type of expense would likely be covered under Medicare Part A if the hospital's dental staff performs the exam. And now let's go to Medicare Part B dental benefits. In Medicare Part B, if the physician conducts examination needed prior to kidney transplant or heart valve replacement, then Part B benefits will apply according to CMS. However, when it comes to Medicare Part B, there are two specific sets of services that will not be covered. first involves services used to care, treat, remove, or replace teeth structures supporting the teeth. Example is pulling teeth prior to getting dentures. Second, include those related to teeth and their supporting structures, unless those services are needed to effectively treat a non-dental condition. In this kind of situation, the dental service must be performed at the same time as the covered service in order for Medicare to pay its portion. It must also be performed by the same healthcare professional who performed the covered service, whether that person is a physician or a dentist. Medicare Advantage dental policies. Many Medicare Advantage plans do offer dental coverage, though the exact benefits provided varies based on the plan chosen. So these plans can be HMOs or Health Maintenance Organization, PPOs or Preferred Provider Organization, PFFS or Private Fee-for-Service plans, and S&P or Special Need plans. Base dental coverage. This is another type of Medicare program that provides some level of dental coverage. This means programs of all-inclusive care for the elderly. This is designed to help participants meet their healthcare needs in the community instead of going to a nursing home or other care facility. With BASE, contracts are made with area specialists and healthcare providers to provide participants care for dentistry as well as other services they likely need. This includes adult day primary care, laboratory services, meals, nursing home care, nutritional counseling, occupational or physical therapy, prescription drugs, and more. So to qualify, you must be at least 55 years of age, live in a PACE service area, need nursing home level of care, and be able to live safely with PACE help. Standalone dental plan. Whether you need dental services not covered under a Medicare plan or you don't qualify for coverage options, you always have the option of purchasing a standalone plan. If you're concerned with the cost of the coverage, it helps to compare how much you would pay out of pocket for your typical dental expenses versus how much you would pay for a dental care plan. But if the former is less than the latter, dental insurance may not be the financial decision for you. So, one exception, of course, is if you're facing more complex, thus more costly dental procedures. In this case, it may be more beneficial to purchase a policy that helps offset some of those added expenses. The ideal dental plan contains provisions for three categories of treatment. First is preventive, diagnostic, and emergency services such as cleanings, x rays, and other oral wellness services, and this coverage is usually around 100%. Second is a basic restorative dental care such as fillings, oral surgery, periodontal treatment, and root canal therapy, so the coverage is usually 80%. And the third one is the major restorative dental care such as crowns, bridges, dentures, and orthodontics. Coverage is typically somewhere around 50%. So be aware that individual dental policies often come with a waiting period for more extensive procedures. Therefore, if you're purchasing the insurance to cover major dental issues that you expect to occur in the near future, be sure to look for this provision to ensure that it will in fact pick up the expenses. Also, review your selected dental policy thoroughly so you know exactly what it covers and how much you can expect to pay for the services you need. This can help you decide which policy is best suited to you based on your specific oral health. And also, it can help you budget appropriately. Medicare does rather limit dental health coverage, but other options exist that can potentially help offset these types of expenses. So, Medicare Advantage Plan, PACE, and standalone dental policy are the three to consider. So for more information, you may email us at hello@medicarehealthgroup.com or you may contact us at 925-732-2845. Medicare Health Group, always at your service. That's it. Thank you for watching. Don't forget to hit like and subscribe for more helpful videos on Medicare.